We are now joined on the line by an expert to talk about the efficiency or maybe efficacy of quarantine measures and to also explain the concept of social distancing. So, for that, I'm very glad to be joined on the line by Kelly Hills, a bioethicist and co principal of Rogue Bioethics. Good morning, Miss Hills.
Good morning. Thank you so much for having me.
Thank you for joining us, or should I say good evening? You are calling from the U.S., right?
I am correct. I'm on the East Coast of the United States where it's just going on dinner time.
Thank you very much for joining us. Now, the U.S. has been ramping up its response to COVID-19 following the number of more confirmed cases and also deaths as well. So let's start off by asking you for your evaluation of the current public health measures that have been taken by the government in the U.S. so far.
Well, I think that overall we're seeing some very measured approaches. We're not seeing a lot of what I would consider overreaction. I am not a huge fan of the quarantine efforts that are happening, but overall, the steps we are seeing are very small, and they're beginning with social distancing efforts in both New York and Washington state. And I think that's an appropriate place to begin.
Mhm. Of course, there are different measures being taken in different countries. For example, in Korea, where we have the biggest outbreak outside of mainland China, we don't have exactly a lockdown like we saw in China, but
hmm
people are being informed to stay home or they're advised not to go out. We're working from home. Schools have been shut down for weeks as
hmm
well. Do you think this is an overreaction then?
I actually think Korea is taking some pretty good steps. These are more in line with your average social distancing model, where we try to reduce the number of people who are circulating in the general public who can spread the disease. So, absolutely, for any illness, if you're sick, please stay home. Don't spread whatever you have to anybody. And if so far as some of the other measures, working from home, that's great. I think that's a very good first step to take. Suspending schools, that's, I think, is a little iffy. We don't have a high indication of children being infected by COVID-19, this new SARS-CoV-2. So that could go one of two ways. It could be that children aren't getting sick and thus they're not spreading it, and this is a bit of doing a lot that isn't necessary. Or it could be that kids are getting sick, but they're showing so few symptoms that they're easily able to spread it without anyone knowing.
Mhm.
So if you are in an environment like Korea, as I understand, where it is possible for children to stay home, either because there's extended family who can offer care or parents have flexible jobs, that works very well. In other countries like America, where we don't have a lot of paid time off, we don't have flexible leave, we might just be creating a problem where children are being moved from one care environment to another, and it's not actually solving the problem.
Mhm. You said that you're not sure or you're not a big fan of quarantines, and you're also mentioned in an article not too long ago that you don't think you've seen enough proof in any cases that quarantine is necessary for the COVID-19. But yet, when we look
hmm
around the world, for instance, where China had the most sort of extreme measures of lockdown and quarantines, their numbers have been going down quite drastically. And then we have, of course, the cruise ship that was docked off Japan, and their quarantine
Yes.
measures seem to go very wrong as well. So
Oh.
we see these different cases of quarantines. What is
Mhm.
ideal quarantine measures for containing this outbreak?
Well, we don't know that quarantine is effective. So, one thing that we need to talk about with China is that they actually, at least for Hubei and Wuhan, did something called a cordon sanitaire. And that's where, instead of quarantine, which the Diamond Princess cruise ship is a good example, you tell someone, stay in your room. Do not move. We will bring food to you. We will bring supplies to you. Instead, what China did was they drew a boundary and they said, you may not cross this boundary on
Mhm.
either side. It's also a 14th century method of disease control from when we lived in walled cities and you could just shut the gate and keep people in or out. Now, unfortunately, we know that a lot of people left Wuhan ahead of the first cordon sanitaire, that first quarantine measure. And they went out, but they didn't go far. They just went into Hubei province. So it's possible that we've actually seen a bit of spread of disease from this measure. And the reason in hindsight it looks like it's working is because that boundary has been redrawn over and over again. Within that province, we actually still see that the disease is spreading. Outside of that province, where the only measures that have been taken have been social distancing measures, we have seen a rapid drop-off of cases. In fact, I believe Shanghai has only had one case in the last 6 days.
You mentioned that social distancing can be effective right now compared to what we know about the COVID-19. I would like to ask you about a recent measure that was introduced by the Korean government, just very recently introduced. They said that they would be installing an app on those who are under mandatory self-quarantine because we saw some rogue cases where those who were supposed to be under self-quarantine were out and about and sometimes even traveling as well. So this app is supposed to track them and then signal an alarm whenever they kind of went beyond their home boundaries. What do you think of this as a
Wow.
bioethicist?
That's definitely alarming. I had heard that they were implementing an app, but I had not been able to get details in English.
Very
Boy,
recent, yeah, just this
that
morning, yeah, or last night.
yeah, yeah. Wow. Yeah, that definitely strikes me as infringing upon somebody's rights. This also illustrates one of the problems that we have with using quarantine. We know from previous epidemics, in particular the 2003 SARS outbreak, that roughly 40% of people will violate quarantine, whether you're in Hong Kong or Toronto. We have data from both that show that people just seem to see that as almost a challenge. And so they will violate it if they don't feel like it is applicable to them. And that is, I think, one of the reasons we have to be very careful. And we should only be using it in cases where we do know that asymptomatic transmission happens at a significant rate, where it is a highly transmissible disease and it's highly virulent. You kind of need all three before people really buy in.
When you mentioned the 40% who will violate those quarantines, I guess that's why the Korean government has introduced this app. But whether it actually takes effect or is effective, we'll have to see. I want to thank you very much, Ms. Kelly Hills, bioethicist and co-principal of Rogue Bioethics, for joining us today. Thank you very much.
Thank you so much. Bye-bye.
Bye-bye.